Question 1. In light of recent developments in radiation physics, Mr. Smith is working with a diagnostic imaging facility where they are about to implement a new X-ray system. The system includes an updated X-ray tube design aimed at reducing patient radiation dose while maintaining image quality. In this context, which of the following changes in the X-ray tube design is most likely to contribute to this goal? A. Increasing the tube voltage, kVp, to improve penetration. B. Decreasing the tube current (mA) to reduce the exposure time. C. Incorporating a larger focal spot size to reduce heat production. D. Introducing more efficient beam filtration to reduce low-energy X-rays. Answer. Correct answer, D. Introducing more efficient beam filtration to reduce low-energy X-rays. Explanation. Increasing filtration removes the lower-energy, less penetrating X-rays from the beam, which reduces unnecessary patient dose without compromising diagnostic quality. This process is referred to as beam hardening. Beam filtration is a crucial method in optimizing radiation dose and improving image quality by ensuring that only high-end photons contribute to the image formation. Other options either don't directly address the reduction of radiation dose, increasing kVp, increasing mA, or might not effectively optimize the system's efficiency. Larger focal spot. Relevant guideline. As per the FDA and the ACA guidelines for dose optimization, filtration is an essential method to reduce unnecessary radiation exposure. Question 2. Based on the information available regarding digital imaging systems, consider a scenario where a hospital is comparing two different types of flat panel detectors (FPDS) for use in their radiology department. One system offers a higher detective quantum efficiency EER than the other. Which of the following is the most likely impact of using the system with a higher EER? O. The system with the higher EER will produce images with low resolution. B. The system with the higher EER will require more radiation to produce an image. C. The system with the higher EER will result in a low patient radiation dose for a given image quality. D. The system with the higher EER will increase the noise level in the images. Answer. Correct answer, C. The system with the higher EER will result in a low patient radiation dose for a given image quality. Explanation. Detective quantum efficiency EER is a measure of how efficiently a detector can capture and convert radiation into a useful image. A higher EER means that the system is more efficient at converting the X-ray photons into image information, thus requiring less radiation to achieve the same image quality. Lower EER systems would require more radiation to maintain the same image quality, increasing the patient dose. The resolution of the image and noise levels are not directly impacted by EER in this scenario. Relevant guideline. The ACA's guidelines for quality assurance in diagnostic radiology emphasize EER, a critical factor for optimizing radiation exposure in digital imaging systems. Question 3. Which of the following factors primarily influences the contrast to noise ratio (CNR) in a digital radiographic system? A. The size of the pixel elements in the detector. B. The applied kilovolt peak kVp setting during the X-ray exposure. C. The distance between the patient and the image receptor. D. The type of radiation detector used. E. G. Scintillation versus semiconductor. Answer. Correct answer, B. The applied kilovolt peak kVp setting during the X-ray exposure. Explanation. The contrast to noise ratio (CNR) refers to the ability of the imaging system to distinguish between variations in the tissue's density where noise can obscure the contrast. The kVp setting has a significant impact on contrast. Higher kVp reduces contrast but penetrates denser tissues better, while lower kVp reduces penetration. This balance directly influences the CNR. Pixel size, detector type, and patient receptor distance impact resolution and image quality, but kVp is the main factor affecting CNR in this context. Relevant guideline. The ACA and the Radiology Society of North America (RSNA) recommend careful optimization of AVP to enhance image quality while minimizing dose. Question 4. In the context of medical radiation protection, Mr. Davis is a radiation technologist performing a fluoroscopic procedure. The hospital has a policy for automatic brightness control (ABC) in place How does ABC contribute to radiation dose management in fluoroscopy? ABC adjusts the beam filtration automatically to minimize low-energy X-rays. ABC adjusts the exposure time to maintain consistent image quality while minimizing radiation dose. ABC automatically increases the tube voltage (kVp) during longer procedures. DABC modifies the patient positioning to ensure optimal image quality. Answer. Correct answer. B. ABC adjusts the exposure time to maintain consistent image quality while minimizing radiation dose. Explanation. Automatic brightness control (ABC) is a system used in fluoroscopy to maintain consistent image brightness by adjusting the exposure parameters, specifically the exposure time and tube current (MA). This ensures that adequate image quality is achieved while minimizing the patient's radiation dose. The options do not accurately describe the functionality of ABC in the context of fluoroscopy. Relevant guideline, as outlined by the FDA and international standards, ABC a dose optimization technique that helps balance the radiation dose with the necessary image quality. Question 5. Considering the principles of medical physics when using an ionization chamber for dosimetry, which of the following factors most significantly affects its accuracy in measuring the dose delivered to the patient? A. The physical size of the chamber. B. The voltage applied to the chamber. C. The type of radiation, X-rays, gamma, etc. used. D. The temperature of the room where the chamber is kept. Answer. Correct answer. C. The type of radiation, X-rays, gamma, etc. used. Explanation. Ionization chambers measure the amount of ionization produced by radiation as it passes through the chamber's gas. The type of radiation being measured significantly impacts the chamber's response as different types of radiation, X-rays, gamma rays, etc. ionize the gas to different extents. Voltage and size are important, but radiation type is the primary factor affecting dosimetric accuracy. Relevant guideline. The OPM recommends using specific calibration factors for different radiation types when conducting dosimetry to ensure accurate dose measurement. Question 6. A hospital is assessing its radiological imaging system and looking for ways to improve image resolution. Based on the theory of modulation transfer function (MTF), which of the following actions would most likely improve the system's ability to resolve fine details in the image? A. Increase the X-ray tube's focal spot size. B. Increase the pixel size in the image detector. C. Improve the detector's quantum efficiency key. D. Increase the X-ray tube voltage. A. Answer. Correct answer. C. Improve the detector's quantum efficiency key. Explanation. The modulation transfer function (MTF) is measure of an imaging system's ability to preserve contrast at different spatial frequencies. Higher quantum efficiency key improves the detector's sensitivity to incoming radiation, allowing for better resolution of fine details in the image. Increasing the focal spot size or pixel size generally worsens resolution. Increasing kVp can reduce contrast, impacting the overall sharpness of the image. Relevant guideline. IACA emphasizes that improving key is essential for optimizing image quality in diagnostic imaging. Question 7. In a process of radiation therapy, Mr. Thompson, a medical physicist, is calibrating a linear accelerator (LINAC) system. During the process, he notices that the radiation output is fluctuating. To what extent can variations in the anode angle of the X-ray tube affect the output of the LINAC? A larger anode angle will result in higher radiation output, improving treatment precision. B. A smaller anode angle will result in a higher radiation output, leading to more efficient treatment. C. The anode angle does not affect the radiation output of the LINAC. D. The anode angle only affects the beam quality but does not influence the radiation output. Answer. Correct answer. B. A smaller anode angle will result in a higher radiation output, leading to more efficient treatment. Explanation. The anode angle in an X-ray tube affects the focal spot size and the efficiency of the X-ray production. A smaller anode angle increases the radiation output as it allows more of the X-ray beam to be directed toward the treatment area, improving treatment efficiency. Relevant guideline. As recommended by the Atomic Energy Agency (IAEA), optimizing the anode angle is key to improving beam uniformity and treatment precision in radiation therapy. Question 8. When evaluating digital radiography doctor systems, what is the primary benefit of using a detector with a larger dynamic range? A. It allows for better differentiation between similar tissue densities. B. It reduces the noise in the image. C. It improves the spatial resolution of the image. D. It allows for faster image processing. Answer. Correct answer A. It allows for better differentiation between similar tissue densities. Explanation. A larger dynamic range in a doctor system means that the detector can capture a wider range of X-ray intensities, which improves its ability to differentiate between tissues with similar densities. This is particularly important for visualizing soft tissues or organs that may not have high contrast with surrounding structures. Relevant guideline. The standards for medical imaging equipment require manufacturers to optimize dynamic range for improving diagnostic accuracy in clinical environments. Question 9. Considering regulatory compliance in medical imaging, which of the following actions is recommended to maintain safety standards during the use of ionizing radiation in medical procedures? A. Only wearing personal dosimeters during high-exposure procedures. B. Routinely conducting car testing on imaging equipment and maintaining certification. C. Reducing the frequency of routine maintenance checks on equipment to save costs. D. Ensuring that only senior medical staff are responsible for radiation dose management. Answer. Correct answer. B. Routinely conducting car testing on imaging equipment and maintaining certification. Explanation. Regular quality assurance, car testing and equipment maintenance are crucial for ensuring that radiation-emitting devices are functioning optimally and safely. This includes verifying calibration, imaging quality, and dose delivery. Regular checks help prevent overexposure and maintain compliance with safety standards, as outlined. Regulatory bodies like the FDA and NRC. Relevant guideline. The NRC mandates that facilities perform car tests on radiological equipment to ensure patient safety and compliance with radiation protection standards. Question 10. From the perspective of dosimetry and radiation oncology, Mr. Martinez, a radiation physicist, is determining the appropriate dosimeter for measuring radiation dose during brachytherapy procedures. Which of the following dosimeters would be the most appropriate for this scenario? A. Thermoluminescent dosimeter, TLD. B. Ionization chamber. C. Optically stimulated luminescence oscillatory dosimeter. D. Scintillation detector. Answer. Correct answer A. Thermoluminescent dosimeter, TLD. Explanation. Thermoluminescent dosimeters, TLDS, are highly effective for measuring the radiation dose during brachytherapy because they provide accurate and reliable measurements of both high and low radiation doses in specific locations. Their small size and ability to be used in direct contact with the patient make them ideal for brachytherapy. Relevant guideline. The OPM and IREC ELDS for personal and localized dosimetry in radiation therapy due to their precision and practicality in clinical settings. Question 11. In the context of radiation protection during fluoroscopy procedures, what is the primary goal of using pulsed fluoroscopy? A. To reduce the image quality for faster processing. B. To reduce patient dose by using shorter exposure times. C. To increase the field of view during imaging. D. To improve the resolution of the images produced. Answer. Correct answer B. Explanation. The primary goal of pulse fluoroscopy is to reduce patient radiation dose. This technique works by using short, intermittent bursts of radiation instead of continuous radiation exposure, minimizing the time the patient is exposed to X-rays. This helps maintain adequate image quality while optimizing patient safety. Continuous fluoroscopy, in contrast, exposes the patient to a higher cumulative dose. Pulmonary fluoroscopy also has a reduced dose per unit of time when compared to conventional continuous fluoroscopy. Question 12. During an MRI scan, a patient reports feeling uncomfortable due to the strong magnetic field. What should the MRI technologist do? A. Increase the power of the magnetic field to reduce discomfort. B. Ignore the discomfort as the magnetic field is necessary for image quality. C. Immediately stop the scan and consult the physician if necessary. D. Apply a local anesthetic to the area of discomfort. Answer. Correct answer C. Explanation. In the context of MRI, the technologist must prioritize patient comfort and safety. Strong magnetic fields in MRI can cause physical discomfort, and if a patient reports such issues, the technologist should stop the scan and consult with a physician to assess the situation further. Technologists should always ensure patient well-being during the procedure and adjust scan parameters or position the patient comfortably if needed. Local anesthetics or field adjustments are not recommended unless prescribed by a physician. Question 13. What impact does beam filtration have on the X-ray beam during diagnostic radiology? A. Increases the overall energy of the X-ray beam. B. It removes low-energy photons, improving image contrast. C. It increases patient exposure to radiation. D. It reduces the efficiency of the X-ray tube. Answer. Correct answer B. Explanation. Beam filtration is used to remove lower energy, soft X-rays from the X-ray beam. These low energy photons contribute to patient dose but do not improve image quality as they are unable to penetrate the body tissue effectively. By filtering out these low energy photons, beam filtration enhances image contrast and reduces patient radiation exposure without affecting the quality of the diagnostic image. Filtration does not increase the overall energy of the X-ray beam. It simply removes ineffective lower energy photons. Question 14. Which of the following factors contributes the most to image noise in computed radiography? CR. A. High levels of contrast in the image. B. A high signal-to-noise ratio SNR. C. Insufficient exposure to the image receptor. D. Increased field of view FOV. Answer. Correct answer C. Explanation. Insufficient exposure to the image receptor results in an image with a poor signal-to-noise ratio SNR, leading to increased image noise. This noise arises when there is not enough X-ray photons reaching the imaging plate or detector, which can reduce image clarity. Contrast and field of view do affect the appearance of the image, but inadequate exposure has a more direct impact on increasing noise. Diagnostic quality. The SNR a critical measure for assessing image quality, with low SNR meaning more visible noise. Question 15. Under the assumption that a can use iterative reconstruction algorithms, what benefit does this technique provide in terms of image quality and patient dose? A. It increases the amount of radiation used to improve image sharpness. B. It reduces noise without increasing the radiation dose. C. It decreases image resolution while reducing the dose. D. It significantly reduces the time required for scanning. Answer. Correct answer B. Explanation. Iterative reconstruction techniques improve image quality by reducing noise while maintaining or even lowering the radiation dose. Unlike traditional methods that increase the dose for better quality, iterative reconstruction algorithms can enhance image clarity by using advanced mathematical algorithms to reduce artifacts and noise in the image without needing to increase the radiation exposure. This approach provides significant benefits in both improving image quality and optimizing patient safety by minimizing the radiation dose. Question 16. Which of the following detectors is most commonly used for measuring radiation dose in diagnostic radiology? A. Thermoluminescent dosimeters TLDS. B. Semiconductor detectors. C. Scintillation detectors. D. Ionization chambers. Answer. Correct answer D. Explanation. Ionization chambers are the most commonly used detectors for measuring radiation dose in diagnostic radiology. These devices operate by measuring the amount of ionization produced when radiation interacts with the air inside the chamber. They are widely used because of their reliability, accuracy, and cost-effectiveness in measuring the dose of X-rays in radiological procedures. Thermoluminescent dosimeters, TLDS, and scintillation detectors are also used in certain situations, but ionization chambers are the standard tool for routine dosimetry in radiology. Question 17. What is the primary advantage of using a flat panel detector (FPD) over traditional image intensifiers in fluoroscopy? FPDs provide higher spatial resolution, but FPDs allow for real-time imaging without any lag. C. The FPDs reduce patient exposure to radiation. FPDs are more compact and easier to maintain. Answer. Correct answer C. Explanation. One of the primary advantages of flat panel detectors (FPDS) is their ability to reduce patient exposure to radiation. FPDS are more sensitive and require less radiation to produce high-quality images compared to traditional image intensifiers. This allows for better dose optimization in fluoroscopic procedures while still maintaining diagnostic image quality. Will FPDS do have other benefits? Like compactness and better image quality, their ability to reduce radiation exposure is the most significant advantage in clinical practice. Question 18. When considering quality assurance in diagnostic radiology, which of the following factors is crucial for ensuring accurate image interpretation? A. Maintaining consistent exposure settings and calibration. B. Using high doses of radiation for clearer images. C. Decreasing the number of X-ray projections. D. Relying on automatic exposure control (EC) for all procedures. Answer. Correct answer. A. Explanation. Consistent exposure settings and calibration are essential for ensuring that the images produced are of high quality and accurately reflect the patient's condition. Regular quality assurance procedures such as maintaining proper calibration of X-ray equipment are vital for minimizing variations in image quality. Using higher doses of radiation, reducing projections, or relying solely on automatic control without oversight could compromise diagnostic effectiveness. Calibration ensures that image quality remains stable over time, leading to more reliable diagnostic interpretations. Question 19. How might one explain the impact of increasing the anode angle in X-ray tube design on image quality? A. It decreases the focal spot size and improves resolution. B. It increases the focal spot size and decreases resolution. C. It reduces patient radiation dose. D. It has no impact on the image quality. Answer. Correct answer. B. Explanation. Increasing the anode angle increases the size of the focal spot, which in turn reduces the resolution of the X-ray image. A smaller anode angle concentrates the X-rays into a smaller focal spot, providing better resolution, but with the trade-off of a smaller heat dissipation area. A larger anode angle distributes the heat over a larger area, reducing wear on the anode, but results in a larger focal size, which decreases image sharpness. This trade-off must be considered in X-ray tube design for optimal performance. Question 20. From the perspective of radiation dose management, what is the primary purpose of using automatic brightness control (ABC) in fluoroscopy? A. To adjust image quality dynamically based on patient size and anatomy. B. To reduce the exposure time to minimize motion artifacts. C. To optimize the use of contrast agents in imaging. D. To maintain consistent image brightness during fluoroscopic imaging. Answer. Correct answer. D. Explanation. Automatic brightness control (ABC) is a feature used in fluoroscopy to maintain consistent image brightness despite changes in patient size, anatomy, or positioning. By automatically adjusting the X-ray tube's output, ABC ensures that the image remains at an optimal brightness level, which helps to maintain diagnostic quality while minimizing unnecessary radiation exposure. This allows for visualization of structures without unnecessarily increasing the radiation dose to the patient. Question 21. Considering the design of a mammography X-ray tube, what is the primary reason for the use of a small focal spot in this imaging modality? A. To increase the speed of the image acquisition process. B. To reduce the heat produced during exposure. C. To improve spatial resolution and image sharpness. D. To decrease the radiation dose to the patient. Answer. Correct answer. C. Explanation. A small focal spot in mammography is crucial for improving spatial resolution and image sharpness. Mammography requires high-resolution images to detect small microcalcifications and other subtle tissue abnormalities. A smaller focal spot allows for greater detail and higher image quality, which is vital for accurate diagnosis. While it may increase heat production, the benefit of enhanced resolution outweighs potential issues. Radiation dose is typically managed by other means in mammography, such as compression and dose optimization. Question 22. From the perspective of quality assurance in radiology, which of the following is an essential part of routine quality control for computed tomography (CT) scanners? A. Checking the alignment of the CT gantry. B. Reducing the slice thickness to the minimum. C. Increasing the tube current to the maximum for better image quality. D. Increasing the field of view (FOV) for larger patient coverage. Answer. Correct answer. A. Explanation. Regularly checking the alignment of the CT gantry is essential for ensuring that the X-ray tube and detectors are correctly positioned, which is crucial for obtaining accurate images and ensuring patient safety. Misalignment can lead to distorted images or incorrect dose distribution, which could compromise the diagnostic value of the scan. Routine maintenance and checks are necessary to confirm the gantry's alignment. Other calibration tasks to ensure the scanner operates properly. Slice thickness and FOV should be adjusted according to the clinical needs, not as part of routine care. Question 23. What is the primary purpose of using a scintillation detector in nuclear medicine imaging? A. To detect gamma radiation emitted by radiopharmaceuticals. B. To generate the image through a chemical reaction. C. To create high-frequency sound waves for imaging. D. To amplify radiation from the X-ray tube. Answer. Correct answer. A. Explanation. Scintillation detectors are used in nuclear medicine to detect gamma radiation emitted by radiopharmaceuticals. The radiation interacts with the scintillator material, producing flashes of light, scintillations, which are then detected by photomultiplier tubes and converted into an electrical signal. This allows for the creation of detailed images of the distribution of the radiopharmaceuticals in the body. Scintillation detectors are critical for imaging techniques like positron emission tomography, PET, and single photon emission computed tomography, SPECT. Question 24. When evaluating the impact of digital image processing techniques, such as windowing and filtering on radiographic images, what is the primary effect of windowing? A. It adjusts the image contrast and brightness. B. It reduces the resolution of the image. C. It removes noise from the image. D. It reduces patient radiation exposure. Answer. Correct answer. A. Explanation. Windowing in digital radiography adjusts the contrast and brightness of the image by altering the range of pixel values displayed. This allows radiologists to focus on specific tissue densities or features of interest, enhancing diagnostic accuracy, while filtering techniques are used to remove noise. Windowing primarily affects contrast and brightness, making the image more suitable for diagnosis. It does not impact radiation exposure or resolution directly, although it can influence how the image appears for interpretation. Question 25. What is the effect of increasing the number of photons in an X-ray beam on image quality and patient dose? A. It decreases patient dose and improves image resolution. B. It increases patient dose without significantly improving image resolution. C. It decreases image contrast but improves spatial resolution. D. It increases patient dose and improves image contrast. Answer. Correct answer. D. Explanation. Increasing the number of photons in the X-ray beam results in higher radiation exposure patient dose, but it can improve image contrast. A higher photon count reduces noise, making the image clearer and improving contrast between different tissues. However, this comes at the cost of increased patient radiation dose, which must be carefully managed using techniques like optimization of exposure parameters, e.g., exposure time, current, to balance image quality and dose. Question 26. What is the function of a radiopharmaceutical in a nuclear medicine procedure? A. To generate sound waves for imaging the body. B. To enhance the X-ray beam's ability to penetrate tissues. C. To emit radiation that can be detected for creating images of internal organs. D. To produce magnetic fields for MRI imaging. Answer. Correct answer. C. Explanation. Radiopharmaceuticals are substances that emit radiation and are used in nuclear medicine to create images of internal organs and tissues. When introduced into the body, these substances accumulate in specific organs or tissues and emit gamma rays or positrons. These emissions are detected by imaging devices like gamma cameras or PET scanners, allowing visualization of physiological functions. Unlike contrast agents, radiopharmaceuticals provide functional imaging rather than just anatomical details. Question 27. In an effort to optimize radiation dose during fluoroscopic procedures, which technique is most effective for minimizing exposure? A. Decreasing the exposure time and using low frame rates. B. Using a higher kVp setting without adjusting MAR. C. Increasing patient exposure to ensure higher image quality. D. Increasing the image frame rate to capture more detailed images. Answer. Correct answer A. Explanation. Decreasing the exposure time and using lower frame rates are effective strategies for minimizing radiation exposure during fluoroscopy. Reducing exposure time limits the amount of radiation the patient is exposed to, while lower frame rates can still provide adequate image quality while reducing overall dose. Higher kVp settings can be used in some cases to reduce dose, but it is more effective to control exposure time and frame rates for dose reduction. Increasing exposure or frame rate could unnecessarily raise the radiation dose to the patient. Question 20. In the context of X-ray imaging, what does the modulation transfer function MTF measure? A. The ability of the imaging system to preserve contrast at different spatial frequencies. B. The total radiation dose delivered to the patient. C. The rate at which the imaging system can process and display images. D. The resolution limit of the X-ray tube. Answer. Correct answer A. Explanation. The modulation transfer function MTF is a measure of how well an imaging system can preserve contrast at various spatial frequencies. Essentially, MTF quantifies the ability of the system to reproduce fine details and contrast in the image, which is directly related to image sharpness and quality. A higher MTF indicates better performance in preserving high-frequency details, contributing to sharper diagnostic images. MTF does not measure patient dose or tube resolution directly. Question 29. Given the use of thermoluminescent dosimeters (TLDS) in radiation monitoring, what is the key feature of TLDS that makes them particularly useful for measuring radiation exposure? A. They provide real-time readings during exposure. B. They absorb and store energy from ionizing radiation, which can later be read. C. They are only useful for measuring high-energy radiation. D. They require no calibration and are highly portable. Answer. Correct answer B. Explanation. Thermoluminescent dosimeters (TLDS) work by absorbing and storing energy from ionizing radiation. After exposure, the TLDS can be heated to release the stored energy in the form of light, which is then measured to determine the amount of radiation the dosimeter was exposed to. This makes TLDS useful for monitoring cumulative radiation dose over time. Unlike real-time dosimeters, TLDS need to be read after exposure and may require calibration, but they offer high sensitivity and precision, making them ideal for accurate assessment. Question 30. How might one explain the relationship between the signal-to-noise ratio (SNR) and the quality of a digital radiographic image? A. Higher SNR improves image clarity and reduces image noise. B. Lower SNR results in a sharper image with more detail. C. High SNR leads to increased motion artifacts in the image. D. SNR does not affect image quality in digital radiography. Answer. Correct answer A. Explanation. A higher signal-to-noise ratio SNR improves image clarity by increasing the strength of the signal relative to the noise in the image. This allows for clearer, more detailed images with fewer artifacts, making it easier for radiologists to interpret the findings. Lower SNR, on the other hand, results in a noisier image, which can obscure fine details and reduce diagnostic accuracy. SNI, a critical factor in ensuring high-quality images in digital radiography, and optimizing it is key for obtaining clear and accurate results.